Greetings everyone. As a result of personal business, I have not uploaded a new video in about 3 months now. Between work, education and leisure, for the past quarter I haven't been able to allot time to produce new content. With that said, in the backdrop of the current situation the world faces, I feel it would be very applicable to discuss the issue of health and how this area might be approached in a community/RBE type scenario. What's important to remember is that fundamentally, the idea of an RBE was founded upon the principle of holistic approaches to problem solving. Additionally, public health alongside sustainability has traditionally been a central focus among advocates. The cultivating of access abundance, in the RBE advocates' view, is nigh on essential to truly meeting both of these aims. When discussing the issue of public health, people tend to focus on the issue of healthcare, and while that is important, and is what we're going to be talking about first, there are many other factors to take into account when weighing the health of populations, as well as improving health outcomes. Some examples of this include preventative medicine, among other preemptive measures, as well as baking in public health considerations in many parts of our community design. First, let's talk healthcare. To put it swiftly, in a moneyless society, healthcare is free, as in truly free. You don't need to pay insurance to access it, you don't need to pay taxes into a system to have access to it, and yet you're fully covered for all of your medical needs. It sounds like a fantasy, but here's how it would work. A significant number of people who go into medical careers do so not because it pays well, or even for the job security, but because they feel it is their duty to care for those in medical need. Since in an RBE, the essential needs of these doctors, nurses, surgeons and what have you will be fully taken care of, they, and many people outside of the health sector as well, will do work not to fulfill their need to live, but to fulfill their passions. These considerations, combined with the fact that education in medicine would be readily available to all, leading to an increased supply of medical practitioners, meaning workloads are shared between more people, has the likely outcome of medical professionals working mostly voluntarily. What this means for a hypothetical healthcare system within community ecology and resource-based economics is that there would be a reliable supply of medical professionals to carry out all necessary medical procedures for a community. Medical equipment is something that is likely to be mass-produced according to demand tracked by a resource management system. It might actually be handy for each hospital, for example, to have their own local RMS to keep track of supply inventories. A given medical practice could either upload specialised designs they have produced themselves to later be produced by the community's manufacturing facilities, or could ask a commons cooperative that specialises in medical equipment to produce designs for them. For some equipment, such as PPE, a hospital or medical practice might want to keep a few 3D printers in-house, as these can be useful in the batch production of face coverings, for example, which brings me to the medicine itself. Pharmaceuticals are likely to be standardized and mass-produced in line with demand and with sustainability taken into account. The necessary amount of hospitals, surgeries, and other medical facilities for a given population can be resource assessed either by the community itself or once again through the use of resource management systems. Something I didn't mention beforehand is that since medicine and medical supplies are freely accessible to everyone, this is likely to benefit and reduce disparities in provision for those with additional medical needs, i.e. women and the disabled. One of the things I mentioned at the beginning of the video were preemptive measures we could take in order to maintain and indeed improve the health of communities or a given population. And one way to do this is to place this objective at the centre of the design of communities. For example, what if instead of a city dominated by roads, we constructed a city system with a heavy emphasis on public transport and microtransit, such as electric bikes, scooters and the like, and we kept the city system dense enough so that walking from A to B becomes and remains a viable option for people. Well, this would have multiple implications for public health. Walking and cycling is generally good for people. It gets people more physically active, which within reason has obvious physical health benefits. Today, road accidents are one of the more common causes of premature death. The absence of roads, or cars as we see them today, would therefore result in a noticeable decrease in fatal and severe injury. So therefore, all in all, designing a city around alternative modes of transport as opposed to traditional automobiles is likely to make our communities much safer places to live in. Another thing we could do in designing our communities around health is making them more biophilic in design. For examples of how having city habitats with lots of dense vegetation is likely to result in fresher air, since these flora will absorb pollutants from the atmosphere, and this is likely to reduce cases of respiratory illness, such as asthma, for example. Not to mention that having a sense of being surrounded by nature has been linked multiple times to a net benefit in mental and emotional health as well. And there's many other benefits to this, even trivial ones like the fact that trees can provide sun protection. I'm sure there are many other benefits, but I won't get into them here. So you're probably wondering, okay, without traditional means of transport, how will ambulances work? Air ambulances are something that's been employed more and more in recent times. With advances in drone technology, such as increased carrying capacity, we could take this a step further and make ambulance via airlift a routine procedure. There will be a couple of advantages to this. Firstly, faster response times. We could automate so-called drone ambulances so that they respond to a distress call whenever and wherever it's transmitted from. The second advantage comes into play after the pickup. Since these drone ambulances are airborne, they can avoid ground level traffic altogether, saving vital minutes that for some could be the difference between life or death. So when you switch from a proprietary economic system to a system such as an RBE, research and development is something that changes quite drastically with regards to many areas, not just medicine. And that is because of two main differences. Firstly, in an RBE, you're not constrained by monetary cost. You know, the world is your oyster. The only limitation to potential research and development would be people's prior, present and future knowledge of a given topic, and also the ability to court people into collaborating with you in various tasks. The lack of monetary cost means that scientists and researchers in an RBE can conduct their research and development much more rigorously than they would be able to under the current system. And what this would translate to in the medical world is much quicker advancement in things like new surgeries and new treatments and medicines for people with certain conditions. Vaccines are a thing that could be developed much more quickly because more resources and time could be put into the development of such. Now, when it comes to making all of this available to the public, the other drastic change is that since an RBE is a non-proprietary system, there are no patents. Today, patents play a big role in the development of things like prescription drugs, and this has a decelerating effect, typically, on the ability for members of the public to access such treatments. In the current system, a drug or treatment gets developed, it goes through trials, and then typically what happens is a private company signs a patent for the treatment's production before it's made available to the public. In an RBE, there's none of that. In an RBE, a treatment would be developed, it would be tried and tested, perhaps approved by an independent body, and then anyone who needs such treatment could access it. If in an alternate timeline, we were in an RBE right now, in the middle of the same pandemic we are in right now, we might have had a vaccine available to people sooner than we're going to have under capitalism, because of the aforementioned rapid development and because of the lack of a patenting process. And this naturally brings me on to how we might fare in dealing with a scenario such as an outbreak within the context of community ecology. So firstly, because of resource-based economics, treatments and immunizations for a given pathogen are likely to be developed and distributed sooner because of the things I described prior. However, there's also the component of designing our communities in preparation for such an event. For instance, while within these communities, we would ideally want to propagate sociability as much as possible. Within the context of an outbreak, that might not be the best thing. And so, preemptively, We need to design our communities so that in the unfortunate circumstance people need to, they can easily socially distance without much trouble. An offhand example of this could be divergent and overlapping walkways in high density zones so that there are more paths for people to travel, thus making it easier for people to avoid contact, if necessary. If a community wishes to, and they would be much more likely to do so since people wouldn't have compulsory work commitments, they could voluntarily choose to instigate a lockdown until the situation improves. I am of the personal belief that a blanket testing system in these scenarios would be most effective at reducing the duration of the outbreak. Testing would likely be carried out by volunteers who opt in, and provided we don't have an automated solution by then, these volunteers could also play a role in providing things like food and other essentials to those who are isolating. And while we're on that subject, our food system is, quite frankly, unhealthy and unsustainable. Using the methods I talk about in my Technologies for Abundance video, which I am due to re-upload with the copyrighted content removed, we could provide fresh, high-quality produce to the world's population while also drastically reducing waste. Because food would be freely accessible to all, no one goes hungry or malnourished. People are less likely to overeat as well due to the anti-hoarding effects of access abundance, which I have covered in my access abundance video, as opposed to the unsustainable nature of traditional agriculture. Things such as vertical farming, hydro and aquaponics, and other technologies can make for a much more capable and sustainable food system. This is relevant because part of maintaining healthy human populations is having a healthy planet for people to live and thrive on. The habitat we live in and the food we eat have a dramatic effect on our own physical and mental health, and so improving our food system and making it more sustainable is a way of achieving just that. I know I have said previously, after each delayed video, that I want to get back into the swing of things, repeatedly again and again, and while I can't make any promises, I do want to start making more content, since quite frankly, so far, this year for the channel hasn't panned out as planned, since I've been very busy with other commitments. My next video will be a re-upload of my Technologies for Abundance video. It got taken down earlier this year due to a copyright claim that was well founded. I hereby apologise to the original creator and will remove said content from the video before I upload it again, after which I will focus my efforts on this channel towards delving deeper into the RBE transition, creating a few more in all honesty videos, and perhaps finally getting my blog up and running. With that said, thank you very much for watching, and thank you for your patience. Stay tuned for more content, and I will see you next time. Peace.